In this video, I'm going to be talking about Singapore, an example of a healthcare system that's working well. In the first section, we're going to look at an overview of the healthcare system, the historic roots, the development of the system, factors that influence that development, who the major stakeholders are, their mandate, mission, and vision. Singapore gained its independence in 1965 and swiftly focused on healthcare improvement. The government improved acute care hospitalization, outpatient care, and implemented maternal and child health clinics. In 1972, families were encouraged to only have 2 children due to the costs associated with the post-war population boom. Medisave was implemented in 1984 and was promoted as prevention is better than a cure. In 1985, the public sector of the healthcare system was restructured to provide higher quality care by implementing a business model. And in 1922, Singapore began taking a national survey of the population's health to highlight areas that needed to be addressed by their healthcare system. In 1996, the Maintenance of Parents Act was passed, allowing the aging population to gain financial support from their children. In 2001, the Marriage and Parenthood Package was implemented in response to a low fertility rate. This package was implemented to support families by offering incentives for having children. In 2002, the ElderShield Plan was created to aid the elderly population and the severely disabled. To further ease the burden associated with the aging population, the Report of Committee on Aging Issues, released in 2006, advocated personal responsibility, early planning for old age, as well as the continued importance of the family as the primary source of care. National Mental Health Blueprint, which was implemented in 2007, aims to strengthen the emotional resilience and mental well-being of the Singaporeans to reduce the incidence of and impact of mental health problems. It stressed the importance of public education and holistic, affordable, community-based care for the early detection and treatment of mental health problems. Lastly, one of the more recent initiatives taken by the Singapore Health Promotion Board in 2010 was to launch the National Grand Challenge to prevent and control obesity, prediabetes in the general population. Factors that influenced system development. Some of the positive contributing factors in this system development are successful economy, strong education, and proper environmental sanitation. Some other contributing factors are financial constraints, specific population needs, like mass vaccination against tropical diseases, diabetes, hypertension, and obesity, and providing financial support to all of the population. The bottom line is, the objective of this system is to provide good and affordable healthcare and to find ways to tackle the challenges of an aging population. Singapore seeks to achieve improved clinical outcomes and enable greater cost and operations efficiency within their system. A stakeholder is a person, group, organization, or system that can affect or be affected by an organizational action or has an active interest in the organization. The stakeholders in Singapore are the public, the government, the healthcare providers, and the private sector. The public has an interest in the healthcare system because it's the recipient of care. The government helps create policies that influence the system by providing packages, schemes, and subsidiaries. The healthcare providers work within the community and in acute care hospitals. The hospital administrators and governing bodies are the administrative aspect of this system. The private sector allows for private health insurance. Singapore's Ministry of Health's vision statement is to ensure quality and affordable basic medical services for all. Their mission statement is to promote healthy living and community health promotion programs. They maintain high standards of living, clean water, and basic hygiene to achieve a better health for the entire population. The mandate of the Singapore healthcare system is how they will achieve their vision and mission statements. They aim to build a healthy population and prevent healthcare issues while encouraging healthy living. Emphasis is placed upon personal responsibility of healthy living through the 3 M's: Medisave, Medishield, Medifund, as well as ElderShield. They control the cost of the healthcare system by controlling the supply of healthcare services and providing subsidiaries at the public health institutions. In this section, we're going to dive into how this hybrid system works, how funding, regulation, and services are delivered and managed in Singapore. Classification of the system. The healthcare system in Singapore is a hybrid system and is difficult to classify using Boehm's model. When we went through this system and attempted to understand it, we came up with a combination of an etatist social health insurance system and the national health insurance system. Financing is a combination of society and state, regulation is by the state, which is the Ministry of Health, and service and delivery is private, much like in Canada. The funding structure in Singapore is a mix of society and state, with the 3 M's being the focus of their system. The funding mostly comes from universal coverage, but citizens do have to take ownership of their health and pay for at least a small portion of their healthcare fees. The 3 M's are MediSave, MediShield, and MediFund. These provide different layers of coverage to help ensure that most of the population has healthcare coverage. We will go into more depths of the 3 M's later on in the video. ElderShield was created in 2002 to help those over the age of 65 with costs of disability and long-term care. There are 5 private insurers in Singapore that citizens can also choose to pay into. What is most surprising about this healthcare system is that they only spend 4% GPD on healthcare and are still ranked 6th by the World Health Organization. This may be due, in part, to having the citizens of Singapore pay at least a small portion of their healthcare. Funding structure. MediSave is a compulsory national savings plan that citizens of Singapore have to pay into. There is currently a $30,000 limit for MediSave accounts. This is to ensure that medically unnecessary treatments are not done using this money. A minimum amount of money also does have to remain in this account for retirement. MediShield. This is a catastrophe medical insurance scheme, started in the 1990s to cover larger healthcare bills. It will pay for 80% of the amount in excess of the deductibles, and the insured, or the person, has to pay the remaining 20%. MediFund. This is intended for those who are in financial need. It is a last resort for patients who can't pay after their MediSave and MediShield are used. There are strict guidelines for MediFund support and will only pay for inpatient treatments in the B2 or C classes, or outpatient treatments in public or hospitals. ElderShield is used to address some of the gaps in the system for aging adults. Depending on what class or ward you choose to stay on, there are different levels of subsidization for the patients. Regulation in the Singapore healthcare system consists of 2 parts, the regulators and the regulated. The regulators consist of the Ministry of Health and the statutory bodies who monitor the public and private healthcare providers. These service providers are required to apply for a license and function up to the standards required by the Private Hospitals and Medical Clinics Act. Healthcare professionals are regulated by their own professional bodies. The Health Science Authority was formed in 2001 as a statutory board to specifically monitor medication, medical devices, and extra supplements. Regulatory bodies. There are 3 main regulatory bodies in Singapore: the Ministry of Health, the Central Provident Fund, and the Monetary Authority of Singapore. The Ministry of Health is in charge of promoting health education, monitoring the accessibility and quality of healthcare services, preventing and controlling disease, allocating resources and specialists, as well as the administration of licenses for healthcare establishments. The Central Provident is a comprehensive and mandatory social security savings plan. It ensures working Singaporeans and permanent residents are able to support themselves in old age. Its objectives are to meet the population's need in retirement, housing, family protection, asset enhancement, and healthcare. Workers and employers are required to make monthly contributions to the employee's CPF into 3 accounts: the ordinary account, the special account, and their MediSave account. The Monetary Authority of Singapore is Singapore's central bank. It regulates the financial aspect and insurance sector. 2 insurance departments of the Monetary Authority of Singapore administer the Insurance Act, which protects the interests of the policyholders and regulates insurers' activities, including registration and licensing requirements. Periodically, the MAS provides direction and practice notes for regulating insurance activities. Singapore offers primary health care, hospital care, long-term care, and other integrated care. Singapore uses a mixed delivery model where the public sector dominates the acute care service and the private sector dominates primary care. Welfare organizations funded by the government provide step-down care, including nursing homes, community hospitals, and hospices. The number of registered doctors, including specialists and nurses serving in the public institutions, is almost 3 times the amount of that in the private sector. There are also varying levels of care, A being the most expensive to C being the least expensive. Now we'll move into Section 3, Health Status of Singapore. Healthcare concerns of the population being served. Despite the high quality of Singapore's healthcare system, the population still faces many healthcare concerns. The healthcare concerns in Singapore can be split into three broad categories: individuals with chronic disease, individuals requiring long-term care and the elderly, as well as the poor and the working poor. Let's start with individuals with chronic disease. Chronically sick individuals are extremely vulnerable under Singapore's healthcare system. The most prevalent chronic diseases that affect these citizens are asthma, COPD, diabetes, hypertension, high cholesterol, and stroke. Just as in Canada, Singapore is also experiencing an increase in life expectancy, which is increasing their elderly population. This puts a higher demand on healthcare services. Older women are particularly vulnerable because they are most likely to have been homemakers their entire lives. MediSave is through the workplace, and it only helps women if their husbands left money in their own account, or if the women voluntarily put money into a MediSave account for themselves. Others rely on their adult children for financial support. Everyone is encouraged to live a healthy lifestyle, as well as the elders are provided with healthcare education to help them live an active, healthy lifestyle. They are taught to eat sensible diets. There have been campaigns such as the National Health Lifestyle Campaign on the importance of eating healthy. They are encouraged to get regular medical checkups, ensure they have enough savings for medical expenses, and Elder Shield was also set up to provide them with additional support. The poor and the working poor are people who require long-term institutionalization and are currently relying on charity organizations. These in turn receive some support from the government. To help mitigate the cost of this, the Comprehensive Chronic Care Program and the Primary Care Partnership Scheme will eventually deliver direct, subsidized long-term care to those suffering from diabetes, high blood pressure, and high cholesterol. There are some welfare organizations and some private organizations that do collaborate with the government to provide care. The community-run hospitals and nursing homes run through government grants and volunteers. Individuals with poor-paying jobs will have small MediSave accounts and no MediShield coverage, and they are more likely to have parents with health problems. Those with sufficient MediSave funds are still having trouble obtaining treatments for conditions such as cancer, stroke, COPD, coronary artery disease, and blood pressure disorders. MediFund helps some, but there can be no assumptions that one will be treated. The middle class is also a vulnerable population. MediShield covers children of the middle income earners, but only if they are included in their parents' plan, meaning their parents have to pay an extra premium. Other healthcare concerns of the population stem from the funding structure. MediSave, the mandatory savings account, has a set amount that individuals can add. This is based on the individual's age. The reason for this is it prevents the excess buildup of MediSave balance, which could ultimately result in the unnecessary use of medical services. For example, spending money on a nicer ward or having an elective surgery. Even though MediSave accounts are personal, the government determines what the money can be spent on and the rate at which it can be spent. They have a maximum withdrawal limit which varies depending on the patient's diagnosis and the cost of the resources. For example, MediSave accounts cannot be used to cover the maternity ward and associated costs beyond the third child, long-term care, congenital abnormalities, cosmetic surgery, abortion, infertility and contraceptive procedures, sex changes, mental illness, AIDS, drug addiction or alcoholism, treatment of injuries arising from direct participation in civil commotion or strikes, and inflicted self-injuries. Thus, MediSave can only be used to pay for relatively inelastic medical demands, such as hospitalization and surgery. For outpatient services, MediSave is only allowed for a few expensive treatments such as vaccinations against hepatitis B, procedures for artificial insemination, renal dialysis, radiotherapy, chemotherapy, and erythromycin treatment. When individuals reach the age of 65, they are able to retire. They are then allowed to withdraw some money from their MediSave accounts. However, they do have to keep a set amount of money in the account. The amount minimum can either be the basic retirement fund amount or the full retirement fund amount. The retirement sum scheme provides members with a stable monthly income that will support the basic standard of living during their retirement for approximately 20 years. The basic retirement sum for those aged 55 in 2016 was $80,500. The full retirement sum for those aged 55 in 2016 was $161,000. In order to strengthen this account, The government induced a series of Medisave top-ups for the elderly starting in 1995. Upon the member's death, the remaining balance in the Medisave account will be paid in cash to the account holder's nominees. The retirement sum scheme sounds great in theory, as members should have peace knowing they are financially stable in retirement. However, this type of system fails when individuals need to draw out more money than they are allowed for varying reasons. The system also fails individuals who had never had a Medisave account in the first place, some of those being the stay-at-home moms or individuals that never earned a substantial, consistent income. For those without a Medisave account, they would resultingly have no retirement funds either. MediShield has been operating in a deficit for many years. In 2003, it collected $54 million in premiums but paid out $65.3 million in claims. As of March 2003, 200,000 people are not covered by MediShield or any other private insurance. MediShield pays 80% of the excess up to a preset limit. Amounts that aren't reimbursed by MediShield would have to be paid out of Medisave, other insurance plans, or out of pocket. In specific cases when the combination of the above funds is insufficient to cover the cost of healthcare, individuals could seek financial help from MediFund. MediShield is expected to cover about 80 to 90% of hospitalizations within the class of B2, and the rest would come out of Medisave. However, 40% of patients in the subsidized B2 ward accumulate medical bills that exceed what they are allowed to claim from MediShield. An ongoing policy issue is to enhance MediShield to make it more relevant and responsive. Another downfall of MediShield is that it does not provide coverage for those over 85 years of age. The final concern with the healthcare system in Singapore is the heavy government control. The government mandates the overall access to and the funding of the healthcare system. They also ration and manipulate the demand by controlling the supply. This tarnishes Singapore's considerable achievements of building their modern healthcare system that is working to satisfy most of the people. So, are the healthcare needs in Singapore being met? Yes. Singapore is the first country to have implemented a nationwide compulsory medical savings plan in the form of Medisave. It has proven to work well for them. In fact, international experts rank Singapore's healthcare system among the most successful in the world in terms of cost effectiveness and community health results. Healthcare is more efficient and of better quality than in most other countries. This is demonstrated through Singapore's high life expectancy, low infant mortality, their exceptionally low GPD health expenditure, and their low public health spending. The policy formation also leans towards efficiency and away from equity, and it places the responsibility of healthcare on the individual. The healthcare system ensures that most of the people in Singapore are taken care of in the event of any illness. There are many factors leading to the success of the healthcare system. The 3 M's have been effective in ensuring that monetary concerns are minimal, as payment is shared between the individual and the government. Lower income groups are also heavily subsidized, especially if they choose C wards. The competition between private and public healthcare in Singapore also leads to cost containment in both. Private healthcare providers are required to publish price lists to encourage comparison shopping. In terms of prevention policies, the government plays a major role with contagious disease and works hard to prevent the diseases by ensuring that good health conditions are a high priority. Additionally, the government has added safeguards to ensure that everyone in Singapore is taken care of, even those who do not have enough savings. Another important aspect of success is the responsiveness of the government to the needs of the population. For example, the Ministry of Health doubled their budget to support the aging population after the 2000 election. It was because they found there was a need for affordable health care in the elderly. ElderShield was introduced in 2002 in response to this need. Singaporeans can now meet their healthcare expenses that occur in the event of severe disability. To provide more assistance to the elderly in need, the government created MediFund Silver, and to provide assistance to the young, they created MediFund Junior. This next section will discuss some of the barriers that accompany the Singaporean healthcare system's delivery. Singapore is currently facing an increase in population as well as an aging population. The population has grown by 25% in the past decade, and it is estimated that by the year 2030, the population will be made up of 20% of elderly people. This combination leads to the immediate demand of an increase in healthcare services for long-term management of chronic diseases and other longer hospital stays. This demand will result in higher healthcare costs, thus preventing a barrier that must be addressed. Singapore has a remarkably low rate of residents who are currently visiting a regular family doctor, only 38.4%. This suggests that Singapore is struggling to offer adequate prevention healthcare and community management of chronic conditions, which would be more cost effective and more sustainable. As previously described, the government will cover 80% of the total hospital bill for certain patients who qualify for this amount of coverage. The remaining 20% is the responsibility of the patient, either through their Medisave account or private savings coverage. Thus, if one does not have an adequate Medisave account or other means to pay, they may not be able to afford the healthcare services they need. Singapore is aware of the areas it falls short. They have developed an action plan to focus on improving accessibility, quality, and affordability of healthcare. This action plan is called Healthcare 2020 and will increase the capacity through more beds and staff. This will be accomplished by using the available beds more efficiently and using private beds for subsidized patients. Approximately 55% of private beds are full at any given time, meaning there are usually empty beds available for use. They will also be adding on to existing hospitals and opening new ones ahead of schedule to account for the increasing population. Healthcare 2020 also seeks to increase the number of community hospital beds, allowing appropriate patients to be treated in a less costly setting, which will address the issue of increased chronic disease management related to an aging population and will increase the overall community involvement. Finally, Healthcare 2020 will increase the healthcare workforce by 50% through expanding their schooling capacity, training more locals, and importing foreign staff to supplement the locally trained workforce. This will ensure that the additional beds and services will have adequate staff to patient ratios. In summary, Singapore is utilizing a highly efficient healthcare system that works for them, as demonstrated by being ranked 6th by the World Health Organization. By placing individual responsibility on health, being highly responsive to the needs of the people, and supporting a large majority of the finances of the system, Singapore has created a successful system.